Hi everyone, it's Katrina Hotucker. I'm here to discuss the topic of hospice. It's not really a social problem, it's more of a personal opinion on if you think hospice is necessary for people or if you think that it makes things worse towards the end. So I'm just here to give a little information about what hospice actually does. So to start off, hospice is an organization that is in place for somebody that has 6 months or less to live for a time span. So if your doctor gives you the diagnosis of 6 months to live, no matter what your medical diagnosis actually is, he will refer you to hospice. And if he refers you to hospice, you can get evaluation from hospice. And if you meet the needs and pass the, I guess you'd call the test or the evaluation that says, okay, yeah, you can be on hospice, or no. But usually after you get the diagnosis of 6 months or less to live, then you are eligible for hospice. So hospice, some people think of it as a bad thing, but in reality it's not. So hospice is there in place for comfort cares. When you're on hospice, all your unnecessary treatments and medical, your medications and everything that is being proactive and isn't really doing much for you. For example, if you have cancer and you are on chemotherapy and it's not doing anything, it's not changing your life expectancy, then that's going to be dropped as you get on hospice, because you're on comfort measures now and you're not improving any by doing that. But say you need to have your blood sugar checked daily, that's going to continue even if you aren't on hospice, because that's bettering your health. It might not make your life expectancy anymore, but it's necessary for your health every day. Hospice is also in place for family. It's really helpful for family when they are going through a tough time like this. When you have to have the discussion with your family member that is passing about hospice and talking to the doctor, that can be difficult. It can be difficult to accept the fact that your family member is passing. So hospice is not only in place to make sure that your family member is comfortable and all of their emotional and spiritual needs are met, and that's really what they base on, is keeping them comfortable and making sure that all their needs that they possibly want and their wishes are met. They also help and focus on making sure that the family is okay. So if family has questions, or family has concerns, or they don't understand why something's happening, or they are going through the stages of, regret and upset and not understanding, hospice is there for them, and hospice will find the resources they need to make sure that they understand and they are being helped also along with the patient and their family member. So I personally have worked alongside hospice workers, and the amount of compassion that they have for residents and their patients is unbelievable. The extent that they'll go to make sure that all their wishes are met is just absolutely amazing. So that is a little bit about hospice, a little bit about how hospice is good, and how if you have a family member that is towards the end of their life expectancy and they have 6 months to live, hospice is an excellent resource to reach out for. I hope you enjoyed my speech and you learned a little bit about hospice. Thank you.